right, I want to show you some techniques for helping with jaw pain, and this is mainly a quick recap or review of what we've done in tonight's class. Marian came in with experiencing jaw pain on her right side after taking a bite of a sandwich in a stressful situation. And what we found is when we looked at her, we saw a gentle dyssymmetry with her jaw coming towards her left. And when we palpated, we also noticed that even though she experienced the pain on the right, that there was more muscular tension on the left. So that's what we started out with. And I beginning feeling drawn to do some compression with the jaw and head. And I was going to do more deep pressure, but once I got in, her body started to myofascially unwind. So instead of putting more deep pressure, I was with it more in a gentle way while it unwound. And when I finished that, I did just a little integrative work through the scalp. And then I did some ear traction where the tips of the fingertips grasped behind and then firmly grasping the ears and like pulling almost like the angle of a tent. I found and unwound her patterns. And let me just show you a little bit. Part of the reason why this works so well is the fascia and membranes that connect to the ear connect with the sphenoid bone. And if you can get the membranes around the sphenoid bone to soften, it connects with all the other bones in the cranium and creates some general release in the area. So this is a slow process. I won't be showing it fully for this review, but that's what I did and followed it out. And when I done, just made a nice transition. And then we came really underneath the cheekbone slowly. And I'm going to give a little lotion here. Slowly came underneath, looking for tension. She had more tension in the left side. And there came to a point where what I opted to do was, while holding the tension in the left side, my right hand came along the joint that had been too open. Left side was too compressed, right was too open. And I just gently oscillated, creating the suggestion of opening and then creating the suggestion of settling more optimally back into place. Suggestion of open and then suggestion of coming back into place, all the while holding the muscular tension on the left side. And I did that, and then I did a couple more strokes, followed it down, around, integrate through the ear, and then you can continue with the same finger if you want, but normally in these finger circles, what I use that as a moment to bring my thumbs, which I find works better for the next piece, and then I integrated how that worked slowly into the neck. And in some cases, I held a couple of tight points and I had her keep her head on the table, and then slowly tuck your chin in towards your chest. And then I let her intuitively move, shortening and lengthening some of the areas in her neck that were tight, and then bringing down to where it inserts in her shoulders and neck. And that's the basic review. She'll probably enjoy receiving some more. But basically started off with jaw pain on one side, did some compression, work with the ears underneath the cheekbones, insertions around the neck, and then down the jaw. So enjoy that.